Welcome back to San Antonio Living. Dr. Mozersky is joining us this morning from Conterlay's Body Institute, and we're talking about Awake Lipo. It's very good to see you.
So good to be here. Thank you so much.
Absolutely. You know, we love having you here because you give us the information that we need. A lot of women are starting to investigate liposuction and taking better care of ourselves, and we want answers. So it's like my own personal physician for 5 whole minutes, except for I'm answering the questions that you guys want to know. What is Awake Lipo? Why is that different than another kind of liposuction?
Okay, well, Awake Lipo is different for 3 reasons. You are awake during the procedure, and it's done basically under a very ingenious type of local anesthesia. So the benefits are you breathe for yourself, you're aware of any mishaps that might occur, and you can warn the surgeon of that.
Right.
That decreases the risk. It also decreases the cost of it because we can do it without an anesthesiologist or hospitalization.
Okay.
And the recuperative time is much more rapid because you don't have to get rid of all the general anesthetic hangover.
So I'll tell you what, this is, you know, a lot of women that I talk to, like, I don't want to go under. I've heard horror stories. You're not under when you're doing Awake Lipo. So you can just really wash that away. You don't have to worry about that at all. The recovery time is much faster. And again, you're saving a little money as well because you're not dealing with an anesthesiologist. A lot of money. I like that. Let's take a look at some of these pictures and let's talk about who is a good candidate when it comes to Awake Lipo. This is someone who had a pretty good result.
Right, and she's a good candidate because she's not really grossly overweight. She has an area or two that really bother her around her middle, which is a common problem. And she had a great result as a result of the surgery.
The before on the left and the after on the right. Exactly. I like that. Quite the six-pack. We've got another picture to show you as well. Is this a good candidate?
Well, this is not the ideal candidate, but this is a good candidate.
Okay.
She was worried about her bra line and some of her waist area, and you can see that she's had an excellent response to that.
You know what? She did, because I looked at that closely because we call it back fat, you know, so I'm checking that out, and I'm seeing much less on the after side, and it's a pretty good result. Okay, what are some other areas that we can do Awake Lipo?
Well, there's some interesting things that people don't think about. For example, cankles, you know, which are a
that area?
That's right.
Oh, and that's a big difference.
Big difference, and you can, you know, there are people that are so embarrassed about that, they don't wear shorts ever. And here's an example of a lady who's back in her shorts because she's got some shape to her ankles.
It's sculpted now, really, is what you did. You sculpted that area.
And there are certain other areas, too, that people don't consider. I mean, for example, male breasts, which we see frequently.
Men can have lipo?
They can.
See, they can.
And they do frequently.
And they do. You don't have to worry about it, guys. I'm telling you, I know. More and more men are turning up in offices like yours. I think we're kind of opening the doors a little bit more for guys to take care of themselves because they want to look good, too.
You'd be amazed, but I bet fully a third of our patients are men.
Really? Very interesting. Okay, we've got a couple more pictures to show. These are some of the other benefits.
Yeah. One of the benefits is you can take the fat that you take out and put it in places. And in this particular instance, we put it in this lady's butt.
You took it from her little tummy right there?
Yeah.
Took it out and put it in her rear to give her a little extra oomph?
Right, and you can see the lift that she got out of that. So that really is a very good use for it, and a lot of people have always wanted a little something back there.
A little J-Lo, yes. And look at, this is another, I love this. This is amazing.
Exactly, and this is an easy thing to do. You can take some of that fat and just put it right in the hands, and we have other things that we do in our clinic to change the skin appearance, but you know, it's a very youthful, rejuvenating kind of procedure, and it's really very easy.
And the official term for that, because I know a lot of you are going to be like, I want that thing to make my hands look younger. It's called fat transfer, and that's basically taking it from somewhere you don't want it and putting it to somewhere where you can use it. You guys are doing innovative things at Conterlay's all the time. You amaze me because Dr. Mozersky is always finding new ways to do things to make people look their best.
That's what we're all about. I mean, we don't really want to be in the same space as other people that do ordinary things. We want to be doing the the good things.
And well, you are doing an amazing job, and I know you've got a special for our San Antonio Living viewers. I'm going to put it up on the screen because I know you want to call right now. You've seen what the Awake Lipo can do. Remember, you don't have to go under for this. So here's the deal. You can get Awake Lipo as low as $1,300 per area, which is a 35% savings. That's huge. And then you can get an additional 10% off one of the areas. And then the first 15 callers right now are going to get 50% off their fat transfer. But you have to call right now because they're tracking these calls, and that is with your Awake Lipo procedure. If you get the answering machine, leave a message because they'll call you right back and take care of that for you.
And this is our Lipo Month special.
This is Lipo Month. Take advantage of it. Do it right now. Here's where you can find Dr. Mozersky. He's with Contour Lay's Body Institute on Stone Oak. The phone number is 494-8446. Again, 494-8446. ContourLays.com. Like them on Facebook. And while you're on Facebook, you can actually ask Dr. Mozersky questions. Look for the Ask Dr. Mozersky question spot on their Facebook page. Leslie will